are listening to the AOTA podcast. Here is your host, Matt Brandenburg.
Our presenting sponsor for the AOTA podcast is New York University Steinhardt's Department of Occupational Therapy. All right. Today we are joined by Jamar Haggans and Andy Bopp. Thank you both so much for sharing your knowledge and expertise on the show today.
You're very welcome.
Yes, I appreciate it. I've been really excited to speak with you both. I've met you at a previous AOTA conference in Kansas City, but it's nice to get to know some familiar faces and speak more in depth on some of what you've been doing since then. Jamar, you are the Director of Quality at the American Occupational Therapy Association, and Andy, you are a Senior Legislative Representative. Today, we're going to be discussing occupational therapy in Medicare home health. And I wanted to start off our conversation by asking you both, what motivates you to improve OT's representation and role within national policy?
I can jump in first. I would say, first of all, I really like, and I guess I would say admire the profession of OT. OTs are focused on helping people with some of the most basic, really parts of your life, getting things done, the basic things that people don't always think of. And that's in spite of the fact it's not really the first profession. If you think healthcare, you might think doctor, you might think nurse. OT doesn't jump first to mind. It's also really not that glamorous. And strangely, I would point out that one of the things that you really help with, including in home health, would be toileting, which is not a glamorous thing to do, I guess. I'm not an OT myself, so I wouldn't sign up to do that. But I really admire a profession that can help with that. I think it's a very caring profession, and I think it's one that's really worth lobbying for. And then secondly, I would say kind of close to that is the issues or your issue, which I would call essentially white hat issues. So there's nothing really hidden. You don't go around, it's a lobbyist, you don't go around begging for undeserved favors or hidden things that you're going to bury, and you're not proud to advocate for it. In fact, I proudly advocate for everything that OT does, and I think it's all for the benefit of the patient, the consumer, and everyone else. And in the world of DC, not every lobbyist can really say that. There's some things that are worth lobbying for more than others. I also think that the fact that the issues that we work on are bipartisan. So one, it really doesn't matter who is in control of Congress, or Republican or Democrat, which is critical because it's split control. And if one party does not like your issue, then you're in trouble. I also enjoy working with both parties. So I consider myself the party of OT, and I can work with Republicans and Democrats. And then finally, your contribution to overall healthcare policy. I think OT is one of those services, one of those professions that can actually really bend the cost curve for Medicare spending, right? Especially in home health. If you prevent the falls, if you prevent the accidents, if you enable the person to live at home, good for the patient, good for Medicare. So really, what's not to like?
Thank you, Andy. It's really refreshing and so awesome from my perspective as a practitioner to hear the great work that you do as a lobbyist for OT and kind of your perspective and understanding of the profession. And I just really appreciate you sharing that with us. And Jamar, what about you? Same question for you. What motivates you to improve OT's representation as well?
Absolutely. So I want to start out by saying that our healthcare system is on a journey moving away from being a volume-based or volume-driven healthcare system to rewarding providers for the value of the services that they provided. So with that being somewhat of the backdrop, it's really important that we have representation at the national level when these value-focused programs are being created or when a program is being modified. So we have practitioners that can speak to the value specifically that we bring to our clients as well as the healthcare system as a whole. So some of the things that motivates me are my personal experience of seeing outcomes of value-driven care, and also not only me seeing those outcomes, but we have the evidence to support the benefits of occupational therapy, especially in the home care. So as Andy said earlier, we have evidence to show that we reduce falls in high-risk seniors. We have evidence that shows that we improve clients' ability to safely perform activities of daily living within their own environment. And we all know as occupational therapy practitioners how important the context is to engagement in meaningful activities. We have evidence looking at OT interventions specifically around health management for those with chronic conditions and saving healthcare dollars there. And also, even from a caregiver standpoint, looking at the quality of life of older adults with dementia, improving their quality of life and their caregivers. So we have evidence for all of that. And it's motivating to know that we have that, we can do that. And we want other people to see that as well. So we are included in these programs.
Why do you feel it's important for OT professionals to understand and be aware of some of the new developments within reimbursement systems and specifically within Medicare?
I'll start with Medicare specifically. So many clients who receive home health care services do so under a Medicare benefit. And the reality is a lot of other payers follow Medicare trends. So it's important to keep up to date with these changes because they can potentially impact practice. And keeping up with new developments ensures OT practitioners provide and bill for services appropriately, and they can advocate effectively. So I'll give you a couple examples of that. One would be the change to the patient-driven groupings model, or PDGM, in 2020. Some practitioners were told that Medicare says they can only have X amount of visits, when in actuality, Medicare does not restrict or dictate visits. They require the beneficiary to receive the services that they need based on their individual characteristics. Another reason why it's so important to actually understand what's going on in the new developments is a common misconception that Medicare only pays for services designed to improve function. The reality is Medicare will pay for services designed to improve or maintain function when it's medically appropriate. Lastly, I want to emphasize that knowing about quality programs that impact reimbursement as well really helps advocate for occupational therapy services. In home health specifically, there is a program called the Home Health Value-Based Purchasing Program, and it measures agencies' outcomes and rewards agencies that provide better quality care. So some of the things that the Home Health Value-Based Purchasing Program looks at is, did a client improve with their shortness of breath? Were there improvements in a client's ability to manage their own medication? How was the functional status at discharge? Was it as you expected or was it better? And those are all things that OT practitioners are working on with our clients, usually in the home health setting. So I think it's important to really know those levers that we can pull when we're advocating. And I'm sure we'll talk about that a little bit later.
I love that. Thank you so much. I think especially as a student and, a newer practitioner, a lot of the focus of our field goes into providing quality care, but a lot of practitioners, I think, aren't aware of, these new developments and how the reimbursement models may be changing and how OT can, how we can change our approach to care to best help our clients. And, I think it's really important to be involved in. And I'm so happy to have both of you, Jamar and Andy, as exemplars and resources to help educate, myself and some other practitioners on some of these topics. And one of which we're going to cover today is the Medicare Home Health Accessibility Act. Can you introduce us? What really is the Medicare Home Health Accessibility Act?
Yeah, sure. The MHHA was introduced as HR 7148 in the House, and that's really the next logical step after we helped to encourage passage of the Medicare Home Health Flexibility Act in 2020, which allowed OTs to open home health therapy cases for the first time. The bill was introduced this past January by Lloyd Smucker of Lancaster, PA, a Republican, Lloyd Doggett of Austin, Texas, a Democrat, both on the Ways and Means Committee, Dr. John Joyce of South Central, PA, and Paul Tonko of Albany, New York, both of the Energy and Commerce Committee. It's a good, solid group of lead sponsors. And what it would do simply is establish OT as a qualifying benefit in Medicare, which means really you could order OT as a solo service, so by itself. Right now, if you're in home health, you can order nursing, PT, or speech by itself, but not OT. And there's really no reason for that other than that Congress has not taken action yet. And it really should be done because certain patients when home health is ordered, may only need OT services, right? And as an example, I often refer to low vision patients. When they're getting into home health, they may not be at the moment where they need nursing. And so what happens now is either that patient does not receive OT in the home because they can't receive it by itself, or, and this I think happens more frequently, although it's not supposed to happen, would be extra services are ordered to get OT in the door. So you'd order OT PT, OT nursing, or even perhaps OT speech. And then one of those three must also make a visit. And then they would normally, after one visit, finish the service, and then the OT would continue. And that's wasteful in and of itself. So it really makes no sense not to have OT ordered by itself. And in the end, it cycles back to if OT is provided, it can save money for the system, which is what we really need to do.
I love that. Thank you for explaining that. That makes it a lot more clear and sounds like this bill can really streamline, OT's approach to care. Andy, why does CMS not already allow payment for occupational therapy as a standalone service?
That's a good question. Only Congress can establish qualifying benefits for home health, so CMS does not have the ability to do it. OT was actually a qualifying benefit for 1 year back in 1980, the last year of the Jimmy Carter administration, and he's actually turning 100, I believe it is tomorrow. And then in 1981, that policy was reversed for budgetary reasons only. That was Reagan's first year in office, and he trimmed spending back a lot. And so a lot of things that were new in 1980 went out the door. Cost was then the issue, why this hasn't been changed over the past 40 years. And I've heard that there were estimated costs that had a B in them. In other words, measured in the billion, up to $1 billion for 10 years. That becomes a very hard bill to pass, which is why, it's been since 1980, 44 years. Really now, why it is something that could be passed is, Jamar referred to PDGM and reimbursement policy. Reimbursement policy for home health has really pushed down on the amount of therapy services provided, which is obviously a bad thing. When it comes to what this bill will cost government, that's got the sideline benefit of really lowering that cost. So we've paid a consultant to come up with a score for 10 years of $223 million. And what a score is, that is the money government would have to allocate to pay to make OT a qualifying benefit, which they would either have to raise taxes to do it, cut some other benefit, or borrow and spend, which is often what happens. But so that is a much lower number. And we on the Hill, when you look at a number with a B for 10 years, $1 billion score, that becomes very hard to do. When you see a bill with $223 million is the cost, that's a lot of money. I look at that and that's a whole lot of money. But in congressional terms over 10 years, that's not. So that is why I think now is the time that Congress can hopefully do it.
That's so interesting. And what do you think that students, practitioners, and educators should understand about this bill and the impact it will have?
Well, Matt, I think Andy really brought up some good points about the bill. And I will just add that this bill is important to the clients that we see now, but even more so important to the clients that we will see in the future as well. So we don't want barriers to accessing occupational therapy services. Andy mentioned an example. I can't tell you the amount of times that I've spoken to members who tell me similar stories about clients not being able to receive occupational therapy services because of some of the issues that Andy spoke about. So it's important for access, and I think also for our professional viability as well. We want the people who need our services to be able to receive those services.
Absolutely. It makes a lot of sense that this bill is being reviewed right now. This bill was introduced in the House on January 30th of 2024. What are the next steps in the life of the bill? And what is, an anticipated timeline for it being implemented into policy?
Well, right now, Congress has gone into recess through the election, so they're not at all in D.C. through October and into November. And then they will be in what is called the lame duck period, because you'll have a new Congress elected in November. And this bill is extremely unlikely to happen then. In fact, I can pretty much say it's not going to happen then. But what will happen, and that's for a lot of reasons, there are a lot of must-pass bills there now, including fee schedule, a lot of things we care deeply about. But what we'll then be working for is reintroduction in the next Congress, which will open in 2025. We'll be working to get a mirror bill in the Senate introduced. And then when the time comes, the committees of jurisdiction will have to address the bill, and that will be the Ways and Means Committee, of which Congresswomen Smucker and Doggett are members, possibly Energy and Commerce, and certainly the Senate Finance. And then as far as when this happens, if you observe and follow Congress, these things can take a lot of time. It will not happen by itself. These things never happen by themselves. It will happen as part of a larger Medicare package, one we felt that this could potentially address rural health issues. It could be fit into a lot of things. Then it comes down to, when does Congress find the time for it? And that's hard to predict. Several years, I think, is a reasonable view. And that can be frustrating for people because they think, well, in the world of commerce, several years is quite a lot of time. But the way Congress works, that's how it is.
Thank you. Thank you for sharing that. And, it's interesting to hear these insights about, the timeline of the bill being implemented in a policy. And I'd love to discuss what practitioners can do in the meantime to really educate themselves and prepare for when hopefully those next steps are taken. And I think it's important to discuss some background information and knowledge first. Our presenting sponsor is New York University Steinhardt's top-ranked Department of Occupational Therapy, which now offers an entry-level OTD for aspiring occupational therapists. NYU additionally offers advanced degrees for practicing therapists that can be completed in person or online. Study and work with leading educators, researchers, and master clinicians in the vibrant setting of New York City, and have access to a diverse patient population and extensive healthcare system. Learn to deliver exceptional patient care, or deepen your knowledge and practice as you focus on applied scientific inquiry and clinical areas such as pediatrics, developmental disabilities, mental health, and assistive rehabilitation technologies. Take the next step by visiting steinhardt.nyu.edu/OT to learn more. I want to ask Jamar, what are some existing inefficiencies that exist in the Medicare system, and how can occupational therapy contribute to the system's improvement?
When clients are referred to home health services, agencies are required to do a comprehensive assessment called the Outcome Assessment and Information Set, or the OASIS, and this was developed by the Centers for Medicare and Medicaid Services. So this OASIS assessment is used to plan care, determine reimbursement, and measure quality. Right now, occupational therapy practitioners can only do the OASIS in certain instances, and that's depending on what other services are ordered. So it presents a problem when you might have an occupational therapy practitioner go out for a visit, but they can't do this because this other discipline was ordered. So it just creates some inefficiencies there when occupational therapy practitioners are more than qualified to collect that information. It is an existing inefficiency of the system. And especially now when you look at staffing and other things that can be barriers to clients accessing services in general. So I encourage OT practitioners to perform the OASIS when you can, in the instances that we can. AOTA does offer a micro-credential to help practitioners complete the start of care, so helping establish competency with that. And that's the start of care with the OASIS. I really encourage practitioners to take opportunities to learn more about how to complete the OASIS accurately if they don't feel confident, and establish competency in that, because hopefully the bill is passed. And when this bill is passed and we are the only discipline that's in, then we will, in that case, be doing that comprehensive assessment at the start of care.
Absolutely. Absolutely. And I think, now's the time to prepare for hopefully that bill's passing and these new types of roles and tasks that practitioners can do to make the transition of care as smooth as possible. Andy, you've mentioned some of the ways that you're highlighting occupational therapy when lobbying and collaborating with lawmakers. I think you've mentioned, focusing on cost savings and access to care in rural populations. What other things or how else have you been able to highlight the importance of OT when lobbying and collaborating with those lawmakers?
Well, I always ask legislators and staff about their experience with OT. And most have some. I won't say all, but most have some, either themselves or often older family members or with their kids, depending on the issue. And, they are often very appreciative of OT. And that's a good way to, open the lines of communication. They therefore understand what OT can do because they've seen it, work in their lives. And then I always frame OT as a common sense solution, focusing, as you said, like on the benefits to the patient and savings to Medicare. And that's overall savings in reduced, hospitalizations, all these other things. Obviously, it doesn't cost nothing or add money to Medicare, but the savings, not every dollar spent is pure cost. A lot of that there is returns on it in saved healthcare costs. And then the key at the end of that, after that thought, is it does save money to the system. Congressman Smucker is very, very fiscally conservative, and he and his staff did quite a long analysis of the bill before they decided to lead it. Again, OT is a service that is great for patients, and it's great for the system, and more of it is needed.
Amen. I love that, Andy. That's awesome. Always awesome to hear. Always awesome to toot OT's horn a little bit, because it can get tough out there sometimes as a practitioner. But what have been some wins or some of the successful efforts and highlights related to quality that AOTA has been a part of?
So the quality team at AOTA monitors opportunities for OT practitioners to get involved at the national level in quality and value initiatives. And some of those opportunities that we monitor are what are called technical expert panels. The technical expert panels are a group of experts that is convened to share ideas, expertise, and opinions to help develop a quality measure or other quality-related topic. 2 occupational therapy practitioners actually participated in the expanded home health value-based purchasing technical expert panel. So I'll just go over the home health value-based purchasing program again, and it's just a system that's designed to give Medicare certified home health agencies incentives to give higher quality and more efficient care. So they look at areas like improvement in shortness of breath, management of oral medications, functional status, the client's experience, and hospital readmissions, to name a few. And depending on how agencies perform, they receive positive or negative payment adjustments. One of the reasons why it's so important to have OT practitioners at the table when these conversations are happening, when they're looking at how do we revise this system to make sure it's meeting the needs. And OT practitioners are able to bring up things like, hey, when you're looking at functional status, we're not including self-care activities like bathing and dressing, which are critical to a client's safety when they're at home, or emphasizing the importance of medication management as it relates to the management of chronic conditions, and even looking at functional cognition and how that impacts performance as well. So it's great to have occupational therapy practitioners to share these perspectives and really highlight how important they are to other clinicians in different healthcare areas that might be looking at different things. And that's why I think it's really important for us to be able to talk about not only the value that we bring to the clients, but I think that's a good example of how we bring value to the healthcare system as a whole.
I love that. Yeah. Thank you for sharing that example. I think it's a wonderful illustration of how practitioners can advocate and be involved in improving quality of care. Andy, what are the types of research and resources that you employ to encourage policy change that more fully incorporates occupational therapy?
I always leave behind the OT and home health savings fact sheet, which was developed by Courtney Leverance, who did her OT capstone with us. And this document lists multiple studies demonstrating savings achieved by OT in the home. And this includes studies on OT as it helps to prevent or mitigate the impact of falls, low vision, dementia, and many other chronic conditions. So, and then there are references to all of these studies. So it's not just claims that we make. There is a lot of research that kind of backs up our position here. And so that's the key thing you want to have. And having it in one place is ideal for these types of encounters.
Absolutely. And I would definitely encourage our listeners, if you haven't seen that savings fact sheet, check it out. It'll be linked in our episode description as well. What recommendations would you give to practitioners to demonstrate the value and positive impact that occupational therapy has on health?
First, start with the client. And I know it's basic and we all know this, and it's just good to be reminded sometimes that what matters to the client is so important. And when we focus on that and when we address those things, the clients can be some of our greatest advocates as far as the impact that OT services has had on their health and well-being. So after looking at what matters to the client, how is quality measured in your settings? We talked about the home health value-based purchasing program, and I do think that's a great example because there are so many things in that program that occupational therapy practitioners are addressing with our clients. So it's really great to be able to go to your rehab director or your administrator and say, hey, I'm addressing these things specifically with clients, and here are the results of that, or here are the outcomes. So I think being able to make those connections and looking at quality improvement initiatives that you can participate in within your agency as well. Occupational therapy practitioners have such a great skill set when it comes to activity analysis and so many other things that make us so valuable for quality improvement activities. So I think that's another way as well to show your value and positive impact that we have on health, and taking it from the client level to really looking at the system level. So what systems can you help shape in your organization if you have the opportunity to do that?
I love that. That's a wonderful recommendation. This is such a encouraging conversation. I think a lot of times practitioners get very honed in on what we can do to help an individual's health. But really, if we can expand our scope to analyze the things that we're doing that helps that individual health improve, it can be creative to apply it to communities, to systems, and even national health efforts. And it's so wonderful to hear straight from both of you who are doing this at a system and national level on ways that we can get more people involved. What have been some of the most, memorable or impactful moments that you've encountered as you meet and collaborate with politicians, Andy?
There's a couple, and I would say the first one would be when a senator was actually speaking to a group of us during a meeting, and she mentioned how much OT had helped her to navigate her kitchen after a broken wrist. So I would describe her as an OT champion at hello. There was also when Congressman Smucker praised the bill in a Ways and Means Committee hearing this year on healthcare, singling out specifically the benefits of OT in the Medicare system and the savings that it can generate. Then there was also when Congressman Doggett stated, we'll get this done, when I met him at an event regarding the Medicare Home Health Flex Act, which is the bill that passed at the end of 2020, enabling OTs to open home health therapy cases. So those are kind of like exciting moments that I would say stand out in working on this issue.
I love that. Yeah, thank you so much. And can you share an example of advocacy efforts that contributed to additional positive outcomes for the profession?
Yeah, there's always many things that contribute to passage of a bill. So it's the lobbying that we do here. It's going to PAC events. So the AOT PAC is very valuable, and I encourage people to participate and donate to the PAC if they are members. It's members coming to advocate on Hill Day, which has just passed in September, but every year plan on doing something like that. And then it's other things. It's really, in the end, we don't get the bill passed. The Congress gets the bill passed, and it's really specific representatives. So it's what Congressman Smucker, he actually wrote an op-ed that appeared in McKnight's Home Health just this past year praising the bill. So these are some of the things that kind of all working together raise a bill to the point where it's actually viable and can then happen. So yeah, they would be the main examples.
I love that. Thank you so much, Andy, for your advocacy for the profession and for sharing these insights with us today. How can OT practitioners stay informed and maximize their own impact and quality and policy efforts that impact the profession?
I can jump in on that one. I would say, definitely just follow AOTA communications. So most of these things are posted on the website. They go out in social media when there's major things happening. Certainly send a note to Congress when there is an effort to get a bill going. Attend Hill Day every year if you can, or contact reps about this bill, and then advocate for yourself and in your practice. So among other OTs, especially if you're in home health, I would advocate to your fellow home health OTs, hey, this is something we should really work on. Check out the website, see what's going on there. And AOTA has a Take Action page, which has sample letters, which you can then send to your two senators and rep, urging them to support this bill. So those are the things that I would do, but really just follow AOT comms on this. And when something is moving on the bill, that will be published.
Absolutely. And I would also say the Volunteer Center, as well as Community, are places where we might post opportunities that are present for occupational therapy practitioners to advocate at the national or many levels. So I think those are things to also look at. But I also want to say it's so important that when we are thinking about advocating for our profession, that it starts with every single one of us as well. So focusing on using evidence-based practices in our treatment sessions, documenting our services accurately, and connecting our outcomes to what matters to the client, but also can we connect those outcomes to the facility or organizational outcomes? And I think those are important advocacy tools as well. And I really want to make sure that I highlighted that too.
I love that. I love that. In a way, providing high quality care is a form of advocacy for practitioners, patients, for everyone involved. That is wonderful. What are some additional resources or actions related to the MHHAA? Did I get that abbreviation correct?
That's MHHA, either way.
I added an extra A. But what are some additional resources or actions that you'd like to recommend to our listeners?
Well, as you said before, I would download that fact sheet on the Home Health Accessibility Act that's on the website here and distribute that to either your fellow home health OTs or others or your boss. I mean, that gives a lot of information on the savings. It always helps to educate everyone you can about that. Definitely visit the Legislative Action Center, as I said before, and then send letters to your reps or to your rep and senators. And you could do that now, but I would also highly recommend doing that in the new Congress as well, when we'll be working towards introduction. Yeah, again, once the bill is out there and when we let you know something is moving, that's when it's a good time to, I guess, really flood the zone with communications. And that'll be next year.
And I'd like to add the home health evaluation checklist as well. We've talked about connecting our outcomes that we get with our clients to organizational outcomes as well. And the home health evaluation checklist incorporates both measures from the quality reporting program and the value-based purchasing program. So it gives occupational therapy practitioners really the language and the base of what's being looked at with how quality is measured at the organizational level.
I love that. Yeah, those are excellent recommendations. We'll have all the links to point listeners in the direction so they can access everything we've discussed today. We end each episode with the Golden Nugget segment, and I'm really excited to ask both of you if you could share one piece of advice or one recommendation with practitioners. What would it be?
I would say if you're in home health, do the Oasis as often as you can. That's something that you've only been allowed to do for a couple of years now, and it's still with therapy only. During the public health emergency, it could be with any case that included nursing. That's no longer the case, although CMS is looking at that now. But the more you do that, the more experienced you will be, the more valuable you will be to your home health agency. And then you'd be really roaring and ready to go for when OT only occurs, because at that point, you would have to do the OASIS because no one else would do it. You'd be the only patient, or you'd be the only professional in there. So that goes along with advocating for yourself, but I think that is the key for home health OTs.
I would say know how value and quality is measured at your agency and be able to speak to how occupational therapy services are influencing those areas. And really, at the end of the day, when we look at our stakeholders, which are our clients, the organization, they all really want the same thing, or they have overarching goals, and that's good quality care at a reasonable cost, and clients have good experiences. So focus on those things and know what's being looked at your agency so you can advocate for how occupational therapy services in specific are moving the needle in those areas.
I love it. Those are wonderful recommendations and wonderful nuggets to add to the ones that you've already shared with us. Jamar and Andy, I just want to thank you so much for taking the time to be featured on the show and sharing all of this excellent knowledge and information with us today.
Happy to be here.
Absolutely. You're very welcome.
Thank you, listener, for tuning in, and thank you to NYU Steinhardt Program in Occupational Therapy for sponsoring this episode.
Thanks for listening to the AOTA podcast. Tune in again next time.